If you traveled to Hawaii over the past 17 months, you're familiar with the state's Safe Travels program.
The COVID-19 airport procedures were confusing at times, creating stress for some travelers. Still, state officials insisted the program was necessary to keep the community safe. How much did Safe Travels Hawaii cost? KITV4's Leah Kamana looked into the program's price tag with the story that's all new tonight.
While the final cost of Safe Travels is still being tallied, Major General Kenneth Hara estimates the cost will be about $37 million.
Originally, it was about $1 million a month to where we're about $3.1 million per month.
That $37 million going to personnel, startup costs for the digital platform, airport screening, digital devices for screening, PPE for screeners, Roberts Hawaii, World Freight Services, AMR for testing and ambulance services for positive travelers, call centers, and improvements to the digital platform along the way.
When we first started the Safe Travels Hawaii, not many travelers were coming into the state. As an example, we started with about 80 screeners statewide, and that grew up to about 560.
Not included in that total, the $27 million worth of airport equipment, thermal scanners, and tracing cameras that were installed statewide.
So that was a separate thing, Department of Health and Department of Transportation airports. So that's not included in my budget.
It took weeks of requests for me to get these totals and find out that the millions of dollars in airport equipment aren't even part of the same program. Now, some state lawmakers do tell me they wish the Ige administration would be more upfront about the costs and breakdowns of COVID-19 related expenses.
It's a question that we've been asking since last year, and we need to have a correct accounting of how much money out of all the ARPA funds we spend for various programs.
Safe Travels, as well as the airport equipment, were funded through federal dollars, specifically through American Rescue Plan Act funds, which were allocated to states specifically for COVID-19 related expenses.
We also want to know how much in ARPA funds we have left, because the last thing we want to do is spend taxpayers' money when we can actually use federal relief monies.
Knowing how much was spent is vital to knowing how much is left as the state looks to the future of the pandemic.
The more we know and the more that we look at our experience, then we could plan better for the future.
Although separate programs, Safe Travels and the airport equipment comes to a total of $64 million. Was it worth it?
I think it was a huge success. Obviously, you look at the numbers, Hawaii had the lowest, I believe the lowest death rate and the second lowest infection rate.
These are some of the things that we had to do, and I think those were good measures, especially since the federal government provided a lot of the support.
The Department of Health did track COVID-19 cases by resident status and travel history. You are taking a look at that data now, and by the numbers, only 4% of positive cases came from travelers, both resident and visitor. More than 50% were community spread. In Honolulu, Leah Kamana, KITV4 Island News.